No one chooses to be in an accident. Nobody prefers an organ transplant to their own healthy heart or liver. No children enjoy physical therapy more than playing with friends. When patients and families are here, it's not because they want to be, it's because they need us to help them through a difficult time. Clarian is not an easy place to even imagine. 3 major hospitals, linked by a futuristic people mover and joined by a shared commitment to excellence. A fact reinforced by consistent national recognition. The numbers speak for themselves. And in the single number that means more than any other, 96% of all patients would come back to Clarian or recommend Clarian to someone else. That's a record you make happen every day, because during their stay with us, the average patient and family will have as many as 50 contacts with Clarian people just like you. The roots of Clarian go back to 1908. It's a testimony to Clarian that patients have come to expect the medical miracles that happen here every day. Ironically, it's the extra kindness, the special measure of concern that makes a lasting impression on patients and their families.
I do know that they were extremely professional and caring from the minute I walked in the door to the minute I walked out the door.
My care was excellent from the food preparation folks in the cafeteria on up to the top surgeon. I just can't say enough about them.
I mean, I couldn't do the transplants if somebody wasn't making sure the room was clean for the patient to go into afterwards. They're all part of the team, and they're all Hoosiers, and they're all happy to be here and working.
Our housekeepers are loved by the patients, and they are very close to the patients. Not infrequently, they make the difference in what sort of an experience the patients have. That extra little sign that we care helps.
It helps the patient, their sense of well-being, and the fact that they are very much cared for when they come into this institution.
They made us feel so at home and treated us like people, not like patients. And it was a wonderful experience, really.
On August 13th, Tina Flathman was driving through Indianapolis on her way to a nursing assignment in Arizona. She never made it. At the intersection of I-70 and I-65, Tina was involved in an accident. While on the side of the road, another car came along, flipped over, and landed on Tina.
At the scene of the accident, I recall being trapped underneath the car and having a very spiritual experience, seeing angels that were surrounding me. Then the paramedics arrived, and I remember being taken into their care. As I came to here in the SICU after having my ankle surgery, I remember the nurses in the form of earthly angels, 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 angels.
Oh, I remember faces.
On this day, Tina came back to IU Hospital under a lot happier circumstances. It was a reunion that meant as much to the staff as it did to her.
To have her come back meant so much, more than I can say. This is what nursing is all about. Seeing that we're actually helping people, that we're making an impact in their life, that we're helping them get better and be able to enjoy their lives again.
Thank you.
Thank you.
A lot of nurses and a lot of doctors get credit a lot of times, but she was thanking PSAs and secretaries, and I think because she had a knowledge of hospitals and how work gets done, I think she was even especially more appreciative of the rest of the staff that contribute to her care.
I remember faces.
I just remember so many people. The people that would come in and empty the trash always had a smile on their face. I remember Gladys that works over on Craner, and I called her Sunshine because she was like a ray of sunshine. The night shift people that would come in, they would tiptoe quietly, make sure that you weren't, that if you were asleep, they didn't want to disturb you. But everybody plays a part, and you may not think that you do because you're not directly involved in the care, but you all make a difference.
The initial call came from the Lifeline dispatch area. An accident on 465 left 7 victims with severe burns, and they were coming into Methodist. Within that same time frame, 3 more patients in critical condition were brought into the emergency department. No one who was there that day will ever forget it.
My first impression when I walked through the doors into the Costa Care area of the emergency department was controlled chaos.
In my 8 years being down here in the emergency department, I've never seen anything quite like that.
It was like a MASH unit. There were just so many people who were hurt so badly.
There was no prompting for anyone. People showed up and started doing their jobs. People were coming back who had already left.
What was amazing to me was how everyone worked as one, all the way from myself as a plastic surgeon through the ER staff, the ER residents, the nurses, the technicians, even housekeeping.
That day, everybody was working together. Everybody's working, of course, everybody's working hard. Everybody respected one another. Everybody's calling out, could you do this?
Amongst the staff for each other, there wasn't a lot of yelling or screaming. There was a respect for the severity of the patient's injuries, taking the best care we could for each person, and also there was a respect for the families, letting them know the condition their family member was in.
We had social services from all over the hospital come down to help talk to the families and give them information. Also, the entire chaplain staff that was available came in to be with these people and talk to them.
I think we recognize individuals for their contribution, for what they do here. Whether it would be the secretary, whether it would be a supply clerk, the nurse, the physician in training. We respect each individual for what they bring to the team.
It was just true teamwork.
The standards of service work, and that day is the absolute epitome of how those standards of service work for our institution.
The critical care transport team at Riley has one mission: to provide critically ill children with the highest level of care while transporting them from all over Indiana or surrounding states back to Riley or Methodist. That could be by Lifeline helicopter or fixed-wing aircraft, or with their mobile transport unit. Their #1 job is to respond at any time.
We have 3 teams on duty, Monday through Friday, from 5:30 in the morning until about 10 o'clock at night.
Critical Care Transport, this is Sarah. How can I help you? The Mobile Intensive Care Unit is equipped with any medication or treatment equipment that we would possibly need on transport. It has the same equipment that an ICU room would have.
It takes absolute commitment to be on the transport team because we are a response team. That means that if you came in at 5 o'clock this morning and it's 4:40 and you're going to Evansville, you're going to Evansville. And, it's going to be midnight or 1 o'clock before you get home. And that is commitment. That's taking it beyond just clocking in, clocking out, and I'm done with my job.
Because they are so experienced, the team is very good at doing things like starting IVs and lab draws. Once the team delivers the patient, officially their job is done. But that's not how they see it. Instead, they volunteer to help out on the floors.
When the transport team has downtime, we know that we can call on them for help.
I can go in most cases, just quickly put an IV in, but then it kind of is nice to hold a baby and comfort them and put them into a nice clean bed when you get done.
I think that we work well as a team with the transport team and the ER and the floors, the nursing care. We need each other.
And it's fun because sometimes we'll get up on 2A or 2B or someplace and Those guys are working hard and they're really, really busy. And you walk on the floor and they're like, yay, the yellow shirts are here.
Perhaps the patient's family won't know that it's a transport team member helping us in the room on a very sick child. But we know that, and we appreciate the teamwork and the quality of excellence that they provide for us.
You don't come to work every morning and read your standard of service, but you provide it. You can't have your goal to provide the best possible care, and that is what we demand of everybody on this team, unless you can live those standards.
As an employee, you have vital contributions in the fulfillment of Clarian's mission. We cannot function without the roles you will play. Hello, I'm Steve Wantz, Senior Vice President of Human Resources. I'm sure you want to know how you fit into Clarian's mission and how you will personally contribute to the services we provide. The answer is in contribution management. Contribution management is a process that allows both you and your manager to clearly understand what should be accomplished on the job and how to achieve it. Clarian understands and values the contributions of every employee. We're working hard to create an environment where you will feel a sense of high engagement with Clarian and in turn will receive a sense of high fulfillment from the roles you perform. Every employee in every department participates in the contribution management program. This program emphasizes your essential job functions and behaviors. Essential functions describe what you do or the specific functions of your job. All of the components of your job are noted in your job description. Behaviors focus on how your job is conducted. That is, the attitudes, values, and motives you bring to your job. These behaviors include core behaviors and job family behaviors. The core and job family behaviors plus your essential functions will comprise your contribution. These behaviors distinguish Clarian from every other healthcare provider and sets the environment for how we care for our patients. We call it preeminent patient care. As a result, no matter what Clarian facility patients may come to, they will receive the same level of care and consideration. That's what you make happen every day. The standards of service is an essential component of the Clarian core behaviors. All 6 of the standards of service fit within the 5 core behaviors. Together, the standards of service and the core behaviors assure the delivery of preeminent patient care each and every day. Everyone at Clarian has a contribution to make. The contribution management process focuses on both personal and professional development to allow you to make the most of your career while you are at Clarian. At Clarian, our intention is to be the healthcare provider and employer of choice. This includes having clear and high service expectations for ourselves and for others. When you join the Clarian team, you make a commitment to yourself and to others to work hard and to serve one another as we serve our patients. This includes caring for yourself, caring for others, and caring for the resources entrusted to us. The standards of service and contribution management are an expression of this commitment. We believe participating in the care and service of others is a privilege. It is a privilege that requires special commitment and brings special responsibility.
Not all of us can diagnose an illness, or transplant an organ, or even draw blood or insert an IV. But each of us contributes every day to the total care of our patients. The standards of service result in a meaningful experience that goes beyond medical skill and modern technology for our patients and their families. For each of us, the people of Clarian, the standards of service provide something that you won't find in a handbook.
After 22 years, I still get excited every day, getting up, going in, being a part of something great like Clarian. I'm having the time of my life.
I really enjoy it.
Well, I've been an employee of Clarian this is going on my 10th year, and for me, it's the only place to work.
I've been here for 7 years, almost 8, and I don't have any place else I'd rather work. I'm very proud to work for Clarian.
This is a great place. I love you. I love down here. I wouldn't work any other place.
We want to make sure that, we are the best at what we do and we can provide the services that the community deserves.
You can walk away when you're done and feel good about what you did.
It's nice to work with people who care.